So we tried to make a review of the literature to list all the symptoms and all the tools that can be evaluated in central disorders of hypersomnolence, and also the perception of the patients. So we know a lot about disruption of nocturnal sleep, especially in narcolepsy type 1, also about sleepiness, and not so much about sleep inertia, for example, in idiopathic hypersomnia. But what we have overall is that we can summarize saying that both subjective and objective measures are of major importance. Sometimes they are not aligned, but it does not mean one is better than the other. It just means that we have to keep in mind everything to make a proper diagnosis, to assess the severity of the patient, and then to propose the correct treatment. Because, for example, if you have MSLT with a very short sleep latency, this is objective sleepiness. If you have Epworth sleepiness scale or narcolepsy severity scale with minor score or moderate or severe score, all of these informations are important to take care of the patients. So yes, we have discrepancies, but it does not mean the tests are not correct. It does not mean patients have complaints not impossible to assess. It just means that we have a big picture of the severity of the patients, and we need to consider everything to make a proper diagnostic and treatment. And this was very well done, for example, in the phase 3 results of a Brixton studies, where they assessed both objective and subjective measures and symptoms in the patients, and they could prove that the treatment are effective on all these measures. So this is how we should manage and diagnose our patients now. And this is also what has been said by the patients. So the patient's voice is very important. And we have a lot of publication in that domains with all these symptoms reported by patients and all these prompts and all this information that we have to get from the patients.